But we are, I think, at our next section, which is going to be with Hannah, who I see is here. Hello, Hannah. Hannah's from Healthcare for All, it's a nonprofit that helps support that space in the city and the state. And she is going to be talking to us a little bit about some health insurance for college students, specifically within the changes within Mass Health, or SHIP at least, and then any information on the Health Connector that she can help us with. And then we're going to have a little bit of a Q&A afterwards, but yeah, give it away to Hannah. Thank you very much.
Thanks for having me here. So my name is Hannah Friand, and I'm the Director of Education and Enrollment Services at Healthcare for All. And as Juan said, we're a nonprofit advocacy agency. So we do a lot of policy work trying to get quality, affordable health coverage for all Massachusetts residents. But what I do is I oversee our consumer helpline, and our helpline helps people enroll into health coverage. I also do some policy work around Mass Health and the other state programs. But I know in particular this year is a little bit different than the last few years with changes to the student health insurance program, which is called SHIP. So in the past, I think it's actually been 3 academic years now, Mass Health has been paying the premium for student health insurance and wrapping the coverage as a secondary. And so that means that they were picking up the copays and also covering the premium cost. So Mass Health is no longer going to be doing that. And what that means, yes, it's a big change. So what this means is students can waive the student health insurance if they are on Mass Health and they would have just Mass Health coverage. They can choose to have Mass Health as secondary to student health insurance, but it's not going to help with the premium costs. It will help with copays, but it would not help with the annual fees. So I know that this is a big change for a lot of people. This was kind of a pilot program 3 years ago, and it works really well for a lot of families I know. And so I assume that this will be a question for many people. And I know we're already getting questions about we've spoken with some students who actually want to get the SHIP program, but also want Mass Health as secondary. And there's been confusion on if they can still have both. And the answer to that is yes. But if you're Mass Health eligible, that does fully waive student health insurance coverage, as does the Health Connector insurance options. So in our healthcare system, the subsidized coverage is all through one application. It's through the Health Connector. They make the decisions for Mass Health and for the marketplace. And so our helpline assists people in applying as enrollment assisters and going through that process. For students, it can be a little complicated because they may still be part of their family's household or they may be on their own. And so oftentimes that we kind of coach families through that too, because sometimes, it's a 19-year-old, 20-year-old might not be living with their parents or filing tax. They're not claimed as a dependent. And that's actually important to know for health insurance. So I think that in particular, it's helpful to know that there's enrollment assisters actually across the state. And I'm going to put the link in the chat box right now, as well as our helpline. So our helpline is a free resource. And I'll put the 800 number in the next one too, so that people can call, because I think that there's going to be a lot of questions with this change. And we did hear from some folks where it worked better for them to be on Mass Health directly. So I think that this isn't necessarily a loss for everyone, but for people who liked having the student health insurance coverage as well as Mass Health, it's going to be a big change. And just they have the student health insurance line for Mass Health is going to be supported for, I think it's actually probably going away like this month. So they're still there right now and can help explain this transition, but so should Mass Health workers as well. So I'm going to just put our consumer helpline number in the chat too. So as I was saying about the household, what gets a little bit complicated is for young adults, if they are still on a parent's application, we might need to speak to the parent. So if a student calls us, I would just explain that you might need your parent with you or might need to conference them in, but they can start by calling us so we can see if they have an existing application. We can make updates to their application, or we can create a new application if they haven't applied in the past. There's also, we often get questions about coverage for international students. So international students would not qualify for Mass Health, but can qualify for a coverage through the Health Connector. And if they file taxes in Massachusetts, which they can file at what's called a 1040 NR as a non-resident, they can get the Connector program fully subsidized if they have no income. So they still can get help paying for health coverage. So that's something a lot of students don't know. It's a little bit complicated because they do have to file taxes. So that's another area that if people have questions about that, feel free to send them to us or other enrollment assisters across the state with a website I put in the chat box. And I know international students often are concerned because they might plan on staying and have an adjustment to their status, like going for a work permit or a green card. So we can talk to them about concerns that would affect their immigration status as well. So I see a question in the chat box. For international students, would that include undocumented kids? So international students have a status. They have what's called, it's usually an F1 visa. So they're seen as a resident here, and that's how they qualify for Connector coverage. People who are undocumented can get coverage. It's usually Mass Health Limited, which is for emergencies, Health Safety Net, which covers people at community health centers and public hospitals, or for kids, there's the Children's Medical Security Plan. So there's options there. We can help people with that. They're not able to purchase insurance through the Connector or get subsidies through the Connector, but even with that same application, they can get some help. And so those are the main points I wanted to cover, but I know that usually there's a lot of questions about this. So I wanted to open it up to questions, and I don't know, Juan, are we using the chat box or people, what do you prefer?
I think people are pretty good with just speaking up. I don't think anyone is shy here. So
Great.
If anyone has
Excellent.
questions, yeah, feel free to ask.
I have so many questions. Thank you so much, Hannah, for being here. Okay, so can you sort of like walk us through, so like if I'm a student, last year I had the SHIP, right? I had SHIP coverage.
Mm-hmm.
And now I'm re-enrolling, and I can go ahead right now and waive my health insurance with just my Mass Health card.
Yes.
And then I've been reading, when I do that with students, it says like, this is going to end. And then it says like, you have to choose a like ACO or AOC or something like that, like an associated coverage, something.
Yep. Mm-hmm.
Yeah. So like, do they have to do that?
So yeah. So basically, once you no longer have Mass Health as a secondary coverage, you are prompted to enroll into a plan. I don't know that you have to enroll into a plan before waiving the student health insurance. You shouldn't have to, because you still have coverage. But that is actually good messaging, because once you no longer have that primary student health insurance, you'll get a package saying you need to enroll into a plan, and they'll give you, there's like 18 options, but it's usually chosen by who your primary care is or what healthcare systems you want to be in. And there's help with doing that, and they send like a guide with it.
So is that like, sorry, is that through like, will they just get like an email? Will they get like a packet in the mail? Like,
packet in the mail. Yeah, so they'll get a packet in the mail. Okay. They, unfortunately, Mass Health is not really big on email. The Health Connector sends emails, but Mass Health still doesn't. I mean, it's just, they're just now walking back using fax for like everything. So they're a little bit behind the times. So one important weird factor right now is, so there's the coronavirus. So there's a national state of emergency, which means that anybody who is on Mass Health coverage as of March 18th continues on Mass Health without disruption through the end of the emergency. So what's going to be confusing for messaging is right now people could be all set on their mass health coverage, but we don't know when the state of emergency will be lifted and they might need to take action at that time. I'm working closely with the state and a lot of other advocates are to make sure that people get outreach to if they have to renew coverage or if they need additional information. We're particularly concerned about students because their status could be changing on like if they're included on their parents' taxes or they're not, or there's different ages that change eligibility. So an important message is just keep up to date with your mail, basically, which is, yeah, not the best messaging, but yeah.
I guess I'm curious if anybody in the group has had people been able to waive health insurance with just a mass health card and not other insurance card?
Yeah, good.
Yeah,
Yes,
okay.
definitely. Plenty of times. In fact, I haven't even seen that you need to select a AOC. I haven't seen that pop up.
Does that vary from school to school? Because I have issues with students all the time where they can't waive their health insurance with just Mass Health.
Yeah, me too, Lydia. Same.
Do you know if they're Mass Health limited and not like a Mass Health? Because there's a lot of one thing.
No,
that
they're Mass Health for sure.
It's Mass Health Standard or Family Assistance or something. Okay, because that's another thing that people often misidentify what they're on. They might get a Mass Health card,
Right.
so they think they're on Mass Health, and they might not be. So Mass Health Limited doesn't count for waiving school insurance. Health Safety Net doesn't. So there's a few programs that just
And the Children's Protective one you
Children's
mentioned
Medical
before.
Security Plan.
Yeah, that
that's
one
another
doesn't
Yep.
either.
Yeah, exactly,
Okay.
because it doesn't cover, like emergencies.
Quick question. Hi, I'm Teresa. So I'll get confused about that all the time because I waive students' health insurance all the time, especially for Bunker Hill. So I know, is Safety Net under Mass Health?
So it's a program that you apply for with Mass Health, but it's not Mass Health coverage. It's basically, it's often referred to as free care. It's basically like covering services at community health centers and hospitals. It's not health insurance.
So my question is, the reason why students need health insurance for schools is just in case if anything happens. They can use that to go to the hospital. Why can they waive it for school?
It doesn't cover ambulances even. So, and they have to go to a hospital that's in the Health Safety Net network. So it's just, it doesn't meet criteria as being health insurance because it's basically like a waiver of bills based on income eligibility at certain locations. I hear you though, because they are able to get certain services, but still it doesn't count.
It's I mean, I don't know. To me, it's crazy because the health insurance for school is a lot of money for Bunker Hill, even for like community college right now is like $3,000. And the chance of students going to the hospital, I mean, there's a chance, but it's very low. It doesn't happen. So I feel like for me, it's really, I don't know, it's hard to accept that some students can't even go full-time just because they don't have health insurance. They can't afford to pay the $3,000 for community colleges, even higher for a 4-year school, even when they have something. I don't know. I just...
Yeah, no, I hear you and I agree. But unfortunately, that it's Health Safety Net, it's just not counted and it's not necessarily fair.
I think that's something where we can try to do something with policy and pushing folks who we know in that space about what Teresa was saying with students who want to go full time to college, and even if it's a community college, which is much more affordable than some other institutions, that health insurance fee is
a lot.
Stop them from going full time and then graduating on time. That just delays a lot of things. I know. Sorry
to interrupt. That earlier conversation about the Mass Health card being enough to waive at some schools but not others, do you think there may be a sort of an institution-specific issue here? Maybe a college or a university doesn't read the guidance on this in the same way as others or in the way that they should? I mean, if we can identify patterns like these, then we can, we know where to act so that some students don't run into issue while others don't.
The other thing I wonder too is if, for the safety net students, if there might be some sort of less expensive patch insurance that could cover the ambulance and, in terms of policy, so it's not as expensive. And maybe there could be scholarships for covering it. Maybe in some cases the student could cover it depending on the cost.
One thing I want to add about kids that are undocumented, we often hear people say that they don't have a status and they have a pending status. If you even have a pending application, you get real mass health coverage. So it's really important, just messaging wise, to make sure people say that if they have a pending application, that they can get greater benefits, and that would waive them. We see that all the time.
Hannah, Sarah, good to meet you. I often think that the work that we do to support college students is like so complicated and confusing at times, but you win hands down. And I'm so grateful you're doing what you do. I think it might be really helpful to just have a line of communication from you all to us somehow to let us know whenever that national safety emergency gets changed, then we could kind of message out to our students and reach out. So that would be helpful to know. And then the other thing I would say is the cost of college health insurance really varies from college to college. So, Simmons is $4,700. And in terms of advocacy work, it would at least help students if there was a standard fee for that doesn't vary by institution, because that would make things at least more predictable, just if anyone's thinking advocacy work.
That's helpful. Yeah, and I can see if I don't know if Juan's the right person or but I can definitely keep you guys updated on when the state of emergency changes. Right now it's through, I think it's October 22nd. Unfortunately, it's a determination made by the feds, and the last time it was made on the last day that it was about to expire. So don't expect to have that until late in October. And it gets basically renewed for 90-day increments. Yeah.
Yeah, you can email me and I'll make sure to let the community here know about that. But that is unfortunate that it's very last minute to hear about that. That's even more imperative to know about our October as College Month. Will also include health insurance updates. I don't know if there are other folks who have any questions or.
I had a question, but I don't know. It may require having to go into more detail. But I was just kind of wondering, what for the students since it's COVID, for the students who are taking the majority or all of their classes online, with them still having to pay
Right.
for health insurance, how does that apply
What
to
I
them?
think-
I can understand if a student has to go on campus and they slip and fall, okay, they're covered. But what they're paying for, what do they get? What do they get out of it if they're just doing 100% online class?
Right. I think I don't know, but I think UMass is not doing that, because I try to waive it for a student. I don't think UMass is requiring for students to waive health insurance for at
Yes,
least
they are.
semester. They are?
Yes, 100%.
Wow.
Maybe your students are full-time, but all the full-time
Yeah.
kids at UMass, yeah.
That's very
great.
interesting. So I noticed in the chat that there's a lot on undocumented kids and how they really take the brunt of this because the coverage that they get is not, counted as being meeting the coverage guidelines. I will say that Healthcare for All has been doing advocacy to try to get Children's Medical Security Plan to be, to have basically all kids have mass health level coverage, which would be then extending it to undocumented kids, obviously, too. So that is something we're working on indirectly, but it takes legislative action, unfortunately. So, yeah. So I don't know if there's any other questions for me.
I think that might be it for folks, but I know Would it be possible to, because I know sometimes people prefer to email. People can email me some questions and I can connect with Hannah, or if you feel comfortable sharing your contact info with our group. I think there's going to be a lot of things that come up during this month and even next semester when students are enrolling.
Yeah, I just put my email address in the chat feature. Yeah.
I appreciate it. Yeah, so you can either email me or Hannah about these questions that come up after this. I know often folks are a little more hesitant to talk, but can share a little bit more information via email. So
yeah, and if you have like a specific cases too, then I can help with that too.
Thank you so much. We really appreciate this. I know I personally was reaching out to Mass Health, and like you were saying that they don't have an email. I was calling them, calling SHIP, and I was getting to like one level and then sort of tossed aside. So I think if that's what I'm feeling, the students who don't have any experience with any health insurance before this would be even more lost. So we really appreciate what you're doing and the support you're giving us, at least. So thank you.
Happy to help. And I'll just say, so the enrollment assisters across the state and our helpline help call Mass Health. So when people are running into those barriers, we can do conference calls with them to Mass Health too.
Awesome. That's really great. That's really useful. But thank you, Hannah. And yeah, hope you have a great rest of your day. Thank you.